I'm sitting here, looking out the door, hearing the sound of the rain on the ground, reminiscing about the past, the times we've had. Hi guys, welcome to my YouTube channel. My name is Nurse Lalis and I am back with another video for you guys. It's a new year, 2021, new me. Okay, I don't know about the new me part, but I'm still here guys and I'm so happy to be back. I have lots of exciting content for you this year, so you better stick around to my channel. And today I am talking about a very interesting topic. Today I am talking about something that's very important to the ladies. It's so important. If you are a lady and you are in your reproductive ages, then this is something that you really need to pay attention to. And what is that? So today we are talking about hormonal contraception, also known as birth control. Yes, that's it ladies, that's what we are talking about. I'm finally doing this video. I've seen a lot of people do this video, talk about their experiences, and it's been very interesting to watch those videos. So I decided that I do need to talk about this thing because it's so fitting for me to talk about it on my channel, especially because I'm a health professional. A lot of the people that I have seen talk about it, they are not health professionals and they're talking about that. They're talking about it based from their own personal experience. So I am here to give you all the right information on it. So you better stay. So in this video, I am going to be answering a few questions when it comes to each of the contraceptive methods, right? The first thing that I'm going to talk about is the hormones that are involved in contraceptives and birth control. And then I'm going to talk about how they are used. And then I'm going to talk about the advantages of each of them and the disadvantages. And I'm going to talk about the side effects, right? I'm going to try and keep it to that outline because I don't want to be all over the place. So yeah, the first contraceptive method that I want to talk about is the injectable contraceptives. So, okay, let me put this down because I don't want it to disrupt me. All right, so injectable contraceptives. I am going to talk about two of them. There are two injectable contraceptives that we use. But now, before I get on to talking about the contraceptives themselves, let me talk about the principal hormones that are used and that are found in all of these contraceptives that I will be talking about today. Answering the first question, number one. What are the hormones that are involved or that are used in these contraceptives? So we have two hormones that are in a woman's body, responsible for many different things: estrogen and progesterone, right? So estrogen, it is responsible for quite a lot of functions in regulating your menstrual cycle. So before the first 14 days of your menstrual cycle, we usually have the hormone estrogen. In the first 5 days, it will help, you will be having your period, right? And then after that first 5 days or 7 days of your menstrual period, depending on how your period is, estrogen will help the lining of your uterus to build up again, right? And then progesterone is responsible towards the end of your menstrual cycle. So that is after day 14, like after you ovulate, it will be responsible now for that part of your menstrual cycle. And if you become pregnant, it will maintain your pregnancy. So these two hormones have other functions in the body. Like for example, estrogen decreases the amount of oil in your skin. So it has some good effects when it comes to your skin. And that's why some of the contraceptive methods that have estrogen can also be used in skin conditions. But I'm going to talk about that later on. And then what it does, it also decreases the rate of breakdown of your bone, leading to more stronger bones. And that is why people who are like going through menopause and they don't have estrogen anymore, what happens is that they tend to have brittle bones and osteoporosis, which is a condition of the bones, but we're not talking about that, right? We're just talking about what this hormone does to your body. And then, so those are like some of the good effects, and there are also some bad things that estrogen does to your body, such as it makes you glucose intolerant. So in my previous video, I will link it up here, I spoke about diabetes and how glucose, or the sugar in your body, has to do with diabetes. What it tends to do is it decreases your glucose tolerance, meaning that you will find that when you are on a contraceptive that has estrogen, you may have higher levels of glucose in your bloodstream, which can later lead to diabetes, right? And then another bad effect of estrogen on the body is that it decreases something in your blood that prevents clotting. So now if you are having a lack of this substance in your blood that prevents clotting, you will be more at risk of having blood clots in your legs, blood clots in your heart, blood clots in your brain. So the blood clots in your legs, they can cause a condition called DVT, which is also called deep vein thrombosis. And what happens is that if those blood clots move away from where they were formed, they can travel in your bloodstream, they can go to your heart, they can end up causing a heart attack, they can go to your lungs, that can cause you to have a pulmonary embolism. Then you now start having problems with breathing. All these blood clots can travel to your brain, which can lead you to having a stroke. So we don't want that. That's like one of the dangerous adverse effects of estrogen in your body. Those blood clots, the effect on the blood, the effect on your glucose. Right, so those are the ones that I'm going to mention. I'm not going to mention all of them. Then we have our progesterone, which is the other hormone that I mentioned, right? Progesterone, it can have some depressant effects. So it can like affect your moods, and it can affect your menstrual cycle, which is like one of the problems that people really have with it, and it can cause weight gain. So those are the, like, just a brief summary of the effects of these two hormones in your body. And when it comes to their side effects or the disadvantages, that's where now we are having problems with them. Okay, so let's go back now to our injectable contraceptives. So our injectable contraceptives, we have two types. We have depot, a lot of people know it, it's a 3-month injection. And then we have Esterate, it's the 2-month injection. I'm going to insert their pictures here so that you can be able to see how they look, the depot and the Esterate injection. So how are they used? So what happens is that since it's an injection and you need to get it either every 2 months or every 3 months, you will go to your local clinic. If you're starting for the first time, you can go anytime during your menstrual period. And then as long as pregnancy is excluded, a pregnancy test is done to see that you're not pregnant, then you can get the depot injection. It's an injection. It's given in your buttock. It's given in your buttock, so that can be a bit uncomfortable for most people. But yeah, it's an injection that's given into your buttock, and it is stored in the fat. Both of them, the depot and the Esterate, the 2 months injection, they are stored there. And then throughout the 3 months or throughout the 2 months, they will be slowly releasing the hormones into your blood, right? So which hormone is in the depot injection or the Esterate injection? So the hormone that is responsible is progesterone, right? And the injections only have progesterone, they don't have estrogen, right? So what are the advantages of being on the injection? If you are someone that's not so good at having to remember to take a pill every day, the injection it's a good option, because you only have to remember to go and get an injection either every 2 months or every 3 months, right? Yeah, and so you will find that more people will actually prefer the injection because of the fact that you don't have to remember to take it. And then what are the disadvantages? So a lot of people struggle with the injection. They really struggle so much. I have come across a lot of people who are just like, I don't want the injection, because they've heard many stories of people who've had the injection before and they had like bad experiences. So one of the effects that the depot will have on you, or the no-estrogen injection, because of the hormone progesterone, a lot of people will experience weight gain. A lot of people will experience weight gain, and a lot of studies, some studies have said in a period of like 3 years you will gain weight of about 4 kg, an average of like 4 kg. And some studies have shown that in the first 6 months of taking the injection, you will gain about like 5% of your weight, of your current weight. And then as you take the injection up to 3 years, you will gain more weight. And this is possibly due to the increase in appetite. Some people have found that they have an increased appetite when they are on the injection, and it could also be due to an increased fat deposition. So meaning that the fat that you are getting from your food, it will be deposited in different parts of your body because of the injection. So that's one of the side effects, and really this one, a lot of people struggle with it, the weight gain. And then the second disadvantage or side effect of the injection is that it has bleeding irregularities. So you will either stop having your period completely, or you will have your period, but it will be very irregular, coming like this month it comes, next month no period for 2 months, and then it comes. So you really won't have a consistent cycle of your period. You will always be wondering, and it will just surprise you anytime. Some people, they will bleed, they will have like more heavier periods, and then some will have prolonged periods, like bleeding more than 7 days, more than 10 days. Some people will bleed for 2 weeks or bleed twice in a month. Guys, yeah, depot it's tough on some people. Yeah, so and then another effect, the antidepressant effect. So it will affect your moods. You may find yourself feeling a bit more down, and if you are someone that already had mood problems or mood disorders and depression, and it might make them worse. So if you know that you're already having irregular periods, if you know that you are already overweight or obese, and you know that you have depression, then you want to stay away from the injection. You want to stay as far away as possible from the injection. Now, not everyone will have a bad experience with the injection. So my advice is that if you're thinking of getting the injection, just try it out. It won't hurt to try it out. And then if maybe after 2 or 3 injections, or after a year of using it, you're still unhappy, then you can stop. Okay, the other disadvantage of this injection, I forgot to mention this, and this is very important. There is a delayed return to fertility when you have been taking the injection. So you don't want to take the injection if you know that in 2 years or in a year's time you want to fall pregnant. Don't play yourself. You might end up having to wait 2 years to fall pregnant if you've been on the injection. So it's very important. It's for people who know that like they don't want to have kids anymore. If you're still young, you just got married, and you know that you might want to have kids in the near future, then it's better to stay away from the injection. Some studies have said that they have found actually that there are differences in between the 2 injections. So they have found that people who are on the depot complained a lot, the weight gain, the depressive episodes, the mood changes. So some studies have found that actually people who have a lot of these side effects on depot, if they switch injections and they use the 2 months injection, which is the no estirate, they cope better. So if you're struggling with a 3 months injection, you can try the 2 months injection and see how it will treat you. Yeah, so even with the fertility changes, one study that I read about said that the people who are on depot, for their fertility to return, it took about 5 to 49 months. Like, that's a long time. But when they compared it with the 2 months injection, which is the non-steroids injection, they found that fertility took about 5 to 24 months to return. So 2 years. Yeah. So that is from your last injection, from your very last injection. So yeah, that's the injection. Those are the side effects. But there are some advantages, and you also have to keep in mind that it won't treat everyone the same way. So let's go on to the second contraceptive method now, which is the pill. So we have different types of pills. I'm going to insert the pictures here as well so that you can see how they look. And there are certain pills that are offered in the private sector and the public sector, and they are different. So in the public sector, you will get your Oralcon, you will get your Trifacil, you will get your Famino injection, and Hyan. So those are the names that you're going to find on the outside of the box. Then in the private sector, you will have your Diane 35, you will have your Yaz pills. So with the pills, they are combined oral contraceptive pills, meaning that they have both estrogen and progesterone. And then there will be some pills that only have progesterone only. So as I mentioned, the effects of estrogen. If you have a problem with blood clotting or anything that can predispose you to blood clotting, like high blood pressure or smoking, then you want to stay away from the combined oral contraceptives. And if you are having problems with your blood sugar or you are diabetic, you want to stay away from your combined oral contraceptives because they can increase your blood sugar even more. However, if you have things like acne, if you have problems with your acne, you may be prescribed your combined oral contraceptives like your Oralcon or Yaz or Diane 35 by your doctor if you are having problems with acne. And some people have actually seen an improvement in like about a week of taking. They start seeing that the acne is getting better, right? So those are the effects of the pill. So the pill that has progesterone only is the Hyan. That's the one. And then another effect of estrogen that I didn't mention before is that it suppresses your breast milk production. So you don't want to be on a combined oral contraceptive if you've just given birth and you want to breastfeed. So the better one to take in this case would be the Hyan, the one that has the progesterone. And also you don't want to take combined oral contraceptives if you just had surgery because of the blood clotting. You don't want to take it if you, as I said, you have your high blood pressure and your diabetes. Okay. Now, the advantages I've already spoken about. It can help with your skin and in terms of your bones being strong. And then the disadvantages I've already mentioned. So some of the side effects that people can have on the pills, it's things like your nausea and your vomiting, your breast tenderness, sore breasts, you're feeling bloated, feeling full, migraines. Some people have migraines when they are on the pill. So yeah, if you are having any of this, then you want to make sure that you don't take the pills if you're already having these problems like your migraines. Yeah, and with all of these contraceptives, the risk of breast cancer. So if there is a query breast cancer, then it's advisable for you not to take, like the oral contraceptives. If you have a risk of breast cancer, you don't want to be taking them. What about fertility? So with the pill, your fertility returns, it can return immediately after you stop taking the pill. And actually with the pill, you need to take the pill every day. You need to take the pill every day, and at the same time it's very important that you take the pill only if you know that you are a person who is disciplined, and you can use an alarm so that you don't forget to take the pill, but it's something that you need to take every day. So it is advisable to choose the pill as a contraceptive if you know that you want to have kids in the near future, maybe in like the next 6 months or a year. Then you can take the pill because it's very quick to return to fertility. And another thing that's so important, ladies, if you know you're gonna forget, don't take the pill. Don't do it to yourself. Don't take the pill. The pill, it'll liar. Uzalayeka with the pill. You can miss the pill. If you have unprotected sex, you can fall pregnant. It literally takes one pill missed and you can literally fall pregnant. A lot of people have fallen pregnant while on the pill. And the pill is affected by things like antibiotics, if you're taking antibiotics, and certain drugs like TB drugs, if you are taking TB drugs, and some HIV drugs. So if you want to be on the pill, please, when you go and ask for it, do let your doctor know or your nurse know about these medications. And whenever you are taking antibiotics, let them know. Because wow, you'll fall pregnant. You'll fall pregnant and you're gonna cry. You're gonna cry, sis. So don't do that to yourself, please. Don't do that to yourself. Don't take the pill. All right. So the third contraceptive method that I want to talk about is the implant, also called the implant. I'm gonna insert a picture here. So the implant, it goes into your arm, like right here between your biceps and your triceps. It's inserted here. It's a small rod about like this size, and it's placed just underneath your skin. It's called a subdermal implant, so it goes right under your skin. And with some people that have it, like if they press hard enough here, you can literally see it's just like a small rod. So the implant, it's one of your longer term contraceptive methods, because the one that we have in the public sector, the implant, it stays for 3 years. So if you know that you don't want to have babies within the next 3 years and you're completely sure about it, you can use the implant. So the implant, the hormone that it has is progesterone. So with the side effects and the disadvantages, you might have the same things that you would have with your injection. Yeah, but depending on like the concentrations, because it's over a period of 3 years and the hormones are just like being secreted over a period of 3 years, you might find that you do better on the implant. However, it's different for everyone. It's really just different for everyone. You won't know how it will affect you once you try it. So that's the implant. Yeah, and to insert it, it's just like a small and very quick procedure. They will give you some local anesthetic to numb this area, and like there's a gun. I don't want to scare you guys, but it looks like a gun. I'll insert a picture here. And then it pushes out the rod into your skin, and you won't feel it because you'll be having something to numb that area, right? So yeah, and then in terms of fertility, some people, they return to their fertility straight after taking it out. Some people actually fall pregnant on the 3rd year of taking it. For example, people who are taking ARVs, they're not advised to, especially if they're taking the ARV called Atroiza. I'm going to put a picture here. Atroiza, with the implant, it has been found that in the 3rd year of having the implant, it really just decreases the hormones in that 3rd year, and you can fall pregnant. And I have met people who actually fell pregnant on the implant in the 3rd year, some in the 2nd year. So you can never know sometimes when these things go wrong. But Yeah, but then anyways, with the efficacy, they will always tell you that it's like maybe 99.1% effective, and you might be that 0.1% person who's gonna fall pregnant while on it. So yeah, that's sad. So yeah, that's the implant. Yeah, and the advantages is that for 3 years you're not gonna worry about contraceptives. You don't have to remember to take a pill every day. You don't have to remember to go for an injection, and I mean having an injection every 3 months. So with the implant, you just put it in, and for the next 3 years you're just relaxing. So yeah, some people prefer the implant. Okay, so the next contraceptive option that I want to talk about, I need a drum roll for this one. And actually I want to show you guys this one. Just wait right there. Okay, so the next contraceptive option that I want to talk about is the Evra patch. So this is the hormonal patch. I hope you can see it nicely. So this is my favorite. I really vouch for this one, and I want to show you how it looks. So okay, here's the patch. Oh, okay. Oh, the lighting. Yeah, but the patch is inside this thing. It looks cream. Oh, yeah, it looks creamish. It's a pity I can't open it so that you can see. But yeah, this is the contraceptive patch. It's really nice because, okay, how is it used? So the contraceptive patch, it's literally like just a thin film of, I don't know what to call it, sort of like plastic, or but not really plastic. I don't know what they use for it, but yeah, it's a patch, and you just have to take it out of the packaging, and you can put it, like, you put it on top of your skin. So if you are scared of injections and you don't like taking pills, the patch is for you. Girl, the patch is for you. So the patch, how it works is that you need to take it. There are 3 patches. So there's this box, right? And there are 3 patches inside. Every week you have to put a patch on. I'm going to insert a picture here that will show you the sites where you can put the patch. You can put it on your arm. You can put it on your abdomen, just in front of your, just next to your belly button. You can put it on your upper outer buttock. Where else you can put it on your back as well. So it also like works almost the same as the implant. You put it in there, and for like a whole week it's going to be secreting hormones. So it has both estrogen and progesterone, but I think these are like really low doses, because the patch, it's just so nice. I've never heard anyone complaining of the patch, by the way, and I have no complaints myself because I'm using the patch. Yeah, so you have 3 patches, and every week you need to put on a patch. You start using the patch on the first day of your period. You're going to put your patch on. And then you're gonna, after 7 days, you're gonna remove that patch, you put another one. After 7 days, you remove that one, you put another one. So your last week number 4, you will be without a patch, and that's when you will be having your period, right? So you can still have your period while on the patch. Oh yeah, and I forgot, when it comes to your injection, it's also advisable for you to start the injection when you are on your period, because, not the injection, did I say injection? The pill. The pill. You need to be on your period when you start it. If you're on your period, it just helps with getting your body in tune with the contraceptive and the hormones, and you achieve immediate contraceptive effect if you start on your period. Yeah. It's so messy. Things get so messy if you start like sometime during your cycle. Yeah. But with the injection, you can take it anytime, and with the implant you can put it anytime, as long as pregnancy has been excluded. So this one, you need to be on your period, and then after the 3 weeks of being on the patch, then you'll be able to get your period. Oh, let me drink my water. So yeah, um your okay, so with your side effects, obviously you have the side effects that people will have if they're taking a contraceptive that has estrogen and progesterone, which I've already spoken about: your tender breasts, your low mood, right, feeling bloated, migraines, some bleeding irregularities for other people, and all of that. I've spoken about all of them. Yeah, but I don't know. Hey, I really think the patch is it's so good. I don't know why it's such a great contraceptive. Really, the side effects on this thing, close to none. Close to none. But I remember, I think when I was on my first month of taking this thing after I got married, one day, just out of the blue, I started feeling so nauseous, like so nauseous. And I actually vomited that day. I don't remember vomiting so much. It was just so bad. I don't know if it was because maybe my body was getting used to this thing, but ever since then, I've been totally fine. No headaches, no disturbances to my mood, no sore breasts. Like literally, I've just been fine. And my periods are perfect.
You were scared to hell?
I was scared to hell. I was scared to hell about what?
You were scared.
Oh, when I started vomiting. Yeah, we were really scared because if you start vomiting out of the blue, hey, it could be pregnancy. But yeah, no, it wasn't, which is great. So yeah, I've like everyone that I have come across who has been using this baby over here, they all recommend it. Like I've heard a lot of people saying, yo, the depot, I was so moody, I was so angry, or I had headaches, or I was just bleeding. But the patch, guys, you know what? I feel like this should be a sponsored video, and this company, what company is this? Janssen or Evra? They should sponsor this video because wow, many people are gonna buy the patch after this video. But yeah, so that's basically the patch, guys. It's just wonderful. But yeah, obviously you need to remember to take it every week. And when you are changing your patch, if you put your patch on a Wednesday the first time, that was the first day of your period, you need to change the patch the following Wednesday. You need to keep it on Wednesday. Yeah, if you forget to change the patch, the hormones will expire and you can fall pregnant. So you don't want that. You need to make sure that you'll remember to remove your patch, put in a new one, and all of that. So yeah, I can't think of any disadvantages. Hey, yeah, and I think when it comes to fertility, really it comes back immediately because you still have your periods. Yeah, so what else did I want to say about the patch? What else did I want to say about the patch?
5 hours later.
5 hours.
Okay, very important, guys, very important. If you are more than 90 kilograms, if you weigh more than 90 kilograms, the patch has a decreased efficacy because it's stored, the hormones are stored in the fat. Now, so if you are more than 90 kilograms or you have like a lot of fat, it might be like too much for it to secrete at the right levels to keep you from being pregnant. So maybe if you are obese or overweight, you might need to like think of another option. Also, when it comes to the injection, if you have a BMI of more than, was it 35? I think 35. It has to be administered in your arm instead of your buttock because of the amount of fat in those two areas, since it's also stored in the fat. Okay, so the last contraceptive method that I want to talk about is the inter-uterine contraceptive device. I'm gonna insert it up here. So the inter-uterine contraceptive device, also known as the loop. Yeah, a lot of people know it as the loop. This one, it's a copper T-shaped device. I'm gonna insert it here. Well, it can have copper, it can have hormones, right? So how this one works is that it stays in your uterus, and the one that we have in public, which is the copper IUD, it stays for 5 years. I believe there are others that stay for 3 years, yeah, probably in private. Yeah, but it's inserted inside your vagina, like all the way into your vagina. We use a speculum, which is that instrument that I mentioned in my cervical cancer screening video, that it's used to like open up your cervix, to show your cervix. So they use a speculum to open up and show your cervix, and then they insert the IUD. It stays in your uterus. Yeah, I'm gonna insert a picture. So it stays there and is for 5 years. So if you really know you're absolutely sure you don't want to have kids, then you can use the loop, right? So there are 2 types of loops, as I said. There's a copper T, and there's a hormonal one, which is called the Mirena. The Mirena is available in private, as far as I'm concerned, when it comes to your primary health care. So if you want to get this one on, all you need to do is go to your local clinic or to go to your doctor. If you go to a private doctor, you'll get a prescription to buy the device, and then you go back to your gynae or your doctor to insert it. If you go to public, it's for free. You will just have it inserted there, right? So the one with hormones, it works the same way as all of the other hormonal methods that I have mentioned, right? And then the one with copper, it will secrete copper into your uterus, so it has local effects on the uterus. All right, so with your hormonal contraceptives, how they will work is that actually this copper, the Mirena, the hormonal one, it will inhibit ovulation, so an egg is not released from your ovaries. It will make the uterus in such a way that it is not a good environment to receive a fertilized egg. And the hormones will also increase the mucus on your cervix, so that sperm cannot pass through into your uterus, right? So that's how the hormones work, and I didn't mention this before. Those are the 3 effects that your hormones will have on your body to prevent pregnancy. Yeah, so the advantages when it comes to the loop is that 5 years you don't have to think about pregnancy. And some advantages, some people actually experience that their periods are lighter when they are on this loop, but some people actually experience that their periods are more painful or heavier. So you don't know how it will treat you unless you try it out, obviously. Yeah, and I mean, if 2 years into using it you cannot take all of the side effects or the heavy bleeding, you can take it out. It's not that if you put it in and you have to wait for 5 years. No, if you are not happy with it, you can take it out anytime. Yeah, and then your fertility, it returns as soon as you take it out. Your fertility can return to normal. So those are the contraceptives that I wanted to talk about today. I know this, like, there's such a lot, but if you are like me and you're serious about not getting pregnant, and both you and your husband have, or your fiance, y'all have agreed that you want to have kids maybe after 5 years or after 3 years, then you really want to make sure that before you get married you can even start on a certain contraceptives, so that you can see how it will treat you. And maybe like 3 months before you get married, you can try something out. If it doesn't work for you, by the time you get married you can stop using it. So yeah, try them out. If one doesn't work for you, you can literally try something else. But now another thing that's important to note with all of these contraceptives is that they don't protect against sexually transmitted infections like herpes, like genital warts, like HIV. And when it comes to genital warts, in my cervical cancer screening video, I did say that the virus that causes it can predispose a person to having cervical cancer. So before you get married, you want to make sure that you do the relevant STI or STD tests with your fiance or with your husband, so that you can ensure that you are safe when it comes to these STIs. If you're not going to be using protection after you get married, then you want to know that you are covered from HIV and syphilis and all of these STIs, because family planning or contraceptives does not protect you against those things. So yeah, if you have listened or watched this video till the end, you are a real G. You are the G's of the game. Thank you. And I really hope you benefited from this video. I know it's just been a lot of information. It's been information overload, but it's very, very important. Ladies, we need to be in control of our lives. An unplanned pregnancy can actually be prevented if you stick to a contraceptive method. Okay, so the biggest mistake that a lot of women make, and I've seen this so many times, and I always just feel so bad. I feel so bad for you guys. If you can see that a certain contraceptive method is not working for you, for example, if you're using the injection, you can see that you are moody, depressed, you're just bleeding, and you're not happy with it. Don't just decide to stop it yourself and never go back for your injection and leave it at that. Number one, if you're on the injection and you are bleeding for more than 10 days, you can go to the clinic or go to your doctor and you get pills to stop the bleeding. And then if it's not the bleeding and it's other things, you like headaches or low libido and all of that, don't just stop the contraceptive and think that a miracle is going to keep you from getting pregnant. It doesn't work like that, unfortunately. Life doesn't work like that. You need to do something about it to prevent pregnancy. So if you find that one method is not working for you, go back to your doctor. Go back to your nurse and let them know that this is what you're experiencing. They can advise you on something that you can use immediately, instead of maybe staying 3 months and telling yourself that, oh, you want your periods to return or you just want to have a break. In that break, that's when you're gonna fall pregnant. I've seen it happen so many times. So ladies, be in control of your lives. If you know your finances are not at a good place with you and your hubby, or you know that just emotionally you're not at a good place and you're just not ready to have a child, be on something, be on a contraceptive. You can literally prevent it. I know babies are like one of the best things that can happen to you. Babies are a blessing from God, but the world is a tough place, and if you are not ready to have a baby, you have many problems. So literally all you need to do is just be on a contraceptive. And you know what, don't say I didn't tell you about this. I told you, I gave you the tea on it, and I told you everything that you won't hear from anyone else. So please don't disappoint me, ladies. Don't disappoint me. Don't fall pregnant. I hope my Evra patch doesn't fail me. Then I'm the one who will fall pregnant and I have to come back to you guys and tell you that it failed. But yeah, anyways, thank you for watching this video till the end. Thank you so much to my loyal subscribers who have watched it till the end. I know y'all are going to do great. So thank you so much for watching. Please don't forget to subscribe to my channel, to give this video a thumbs up, and to share this video so that a lot of people can be able to benefit from this information. I love you guys so much, and till the next time, bye.